we are going to look at is the tilt function. So this is where we have our intensifier or receptor, if it's a flat panel, where we can tilt the machine to the left or to the right. And again, I'm being careful not to call it caudal cephalic, because depending on the orientation of my approach to the patient, caudal and cephalic may not be the appropriate terms. So we want to use the term of tilt, and typically the convention would be tilt towards the head, is really meaning more the receptor moves towards the head. So in that instance here, if I wish to tilt to the right, then some machines have a manual lock. This machine here has an electronic lock, and that allows the machine to go ahead and sweep through. And there will be a calibrated dial on the machine which can show you the angle that you're hitting. And then you can undo that, obviously. And then this would be tilt to the left. So if my patient is laying in front of me in neutral position, this would probably be tilt to the feet. And this would be your tilt function.